Greetings everyone, and especially to all our viewers. Today's video in particular is very important as it will be entailing one of the most talked about issues in the country and also that our country is facing during these current past few months. In particular, I will be giving a very brief insight on the hardest and the toughest times that our country is facing due to the surge of COVID-19 cases and its subsequent second wave that we are battling with right now. It's very important for all of us to understand to the causality behind this deadly second wave of COVID-19, which isn't just infecting people but also taking away the lives of our loved ones. One of the major reasons that can be a crucial role player in the surging cases would be the protocol fatigue. According to experts, it's understandable that human behavior is the major factor for the second wave and the COVID-19 pandemic. People became very complacent after sitting inside for a complete 1 year, and as soon as the cases started to drop, the complacency kicked in and people started moving out. From January onwards, large gatherings started happening. Even after in February, when our country recorded the least number of cases, people and the health officials continued to remind our government and the citizens that it's not still safe and that we have not yet won our battle against COVID-19. People did not understand the gravity of the situation, and the complacency continued, and it's made us reach what we are in the face today. Nevertheless, people moved out with less precautions. During the pandemic period of January and February, people chose not to follow the rules and regulations. Government imposed less fines, less rules and regulations. In metros all over the country, people could be seen traveling without masks and without social distancing. Even it's sad to say how even our central government tend to become slightly overconfident in terms of handling the virus and so-called told about its victory. Besides these major human factors, the evolution of coronavirus also depends upon mutation, which is among the most important factors as it is the cause which brings in the major reason of death, that is the fatality. Scientists have detected numerous mutations in the SARS-CoV-2, the coronavirus that causes COVID-19, and some of which are also called variants of concern. India has reported these variants of concerns from several states, including the worst affected ones in the second wave of COVID-19. The initiation of second wave comes around the time when the double mutant variant was detected, and many other mutations and variants are also known which are to be highly infectious. And finally, a triple mutation has also been noticed and found in the second wave of the COVID-19 pandemic. This double mutant variant has also been popularly told as the Indian variant by our own media houses. Not even the WHO or foreign media houses, but our own media houses has reported the double mutant as an Indian variant and a variant of concern globally. Simultaneously, after these mutations, by the end or the mediocrity part of the second wave of COVID-19 which we are facing, people are now seeing a black fungus formation, which is a deadly black fungus after being cured of COVID-19, which is still not treatable, but people and scientists are looking into it. How can it be studied more? Coming to the part how the young population is more affected during the second wave of COVID pandemic, even after the ICMR chief told us about the fact which that 31% people below the age of 30 got infected in the first wave, and only a rise of 1% was shown, that is 32% of people below the age of 30 are now affected in 2021. The fact belongs that the younger population has been going out more in the times of relaxation, because of which they have contracted the virus very easily. And of course, mutation also plays a very vital role in the deadly infections that are being placed not even in the older population but in the young population as well. Finally, it has to be understood on a personal level, on a global level, on a governmental level, that our health infrastructure was severely damaged in the second wave. The government did try to make amends, but it was quite too late for the people who have lost their lives. Yet, the government is making some events. The global patriots of our country, the global foreign policy holders who have supported our nation in the past, are now again trying to help our nation. Subsequently, we all have to understand that this deadly phase will pass on, but with a joint effort, and the joint effort comes only when an individual step is taken of maintaining proper care and precautions. That is when we will pass this entire phase of the second wave of COVID-19 pandemic. And the vaccinations are also happening, which is a good sign. And the people need to be very promising and supportive toward the vaccination drives and get vaccinated as soon as possible. Thank you.